Can we share some examples of how research has directly shaped or improved our clinical programming services and care?
I think this is such a great question for programs. One, are you tracking outcomes? And if the answer is yes, then the second question is, how was tracking outcomes changed or impacted the program? And if you don't have a good answer to the second question, then we're probably not doing enough in tracking our outcomes. And so for us, I can look back on a decade or 15 years and see how we've changed, right? For example, we used to administer research and outcomes tracking at intake, at 5 weeks, at discharge, and now we've moved to more progress monitoring, which is weekly, right? One of the things I think is really interesting we've learned from the outcomes, which is not as surprising to anyone, really, is how important it is to have good family programming. And I've been a part of discussions and presentations where this was emphasized, but I'd never really seen the hard data on how meaningful it is. And it turns out that one of the biggest predictors of long-term clinical improvement was family involvement. And so the more family involvement you had, the better the clinical outcomes were 1 year post. And so in looking at this for us, and I'm talking about we're 2019, 2020, that time frame, we really started to invest more in our family program and offerings and recognizing how important it was for the client's long-term outcomes. That's just one example.
Yeah, I think that having data really does help you refine your programming and know what you need to invest more time and resources to. One thing we saw is that our neurodiverse population was our fastest growing population at the dorm. So we've been adapting programming for that population. For example, we have a neurodiverse DBT group now. So it's the same DBT skills by Marshall Linehan, but we've adapted it to match up with the neurodiversity paradigm. So it's a bit more focused on sensory regulation and actually building those skills tangibly in a way that works really well for that population. And of course, we're collecting data on how that's going so we can continue to refine that approach. And we also have an OCD group that we realized there was a need for it based on what we were seeing in the data. And it's been really great to help clients both process what it's like having OCD with peers who are also going through that and to challenge their compulsions together and then process what that experience is like and continue to refine. And then finally, we also, just another example, have executive function coaching. So it's one-on-one coaching that provides even more accountability for our clients. And that's something we're really excited to not only have as an additional programming, but to measure and be able to give clients feedback on how they're doing. Because I think it really helps to, you can think you're doing well, but maybe if you see how well you're actually doing, it helps to increase motivation. And if there's an area you're not doing so great in, you can actually adapt the treatment plan and probably have gains faster or more profound gains because you understand exactly how to pinpoint what's going on.